The health and medical information provided during this webinar, as well as the questions and responses from the webinar providers, are solely for informational purposes. This content is not intended to take the place of advice or treatment from health professionals. Nothing presented in the webinar is intended to be used for medical evaluation, diagnosis, or treatment. It is not intended to substitute for your relationships with your own healthcare and pharmaceutical providers. Always seek the advice of your healthcare provider before beginning any new treatment, or if you have questions regarding a medical condition.
Dr. Houman is located in Los Angeles, California. He is a fellowship-trained reproductive medicine and surgery specialist who specializes in men's health, including but not limited to male hormone management, sexual and ejaculatory dysfunction, male fertility, male incontinence, and Peyronie's disease. As a minimally invasive microscopic surgeon, he also specializes in vasectomies, sperm retrievals, and penile implants. Tonight, however, Dr. Houman is going to cover injection medication, syringe and dosing, injection techniques, and support options, and then hold a live Q&A to close out the webinar. So to get us started, he's going to cover the erection process. There we go.
Thank you. So when it comes to the erections, it's a pretty unique mechanism, pretty ingenious mechanism that human evolution has, or animal evolution, even other animals have this, but really the idea is in order to get an erection, you have blood flow coming in through the arteries, and the way that the blood stays in the penis is because as blood flow comes in through you could think of it as you have two cylinders in the penis, each one right in the middle of it is there's an artery that carries blood flow in, and on the outside of those cylinders are these veins that carry blood flow out. So as more blood flow comes in, it squeezes against those veins, preventing the blood flow from going out, and therefore you get blood staying in the penis and giving you an erection. So that's in basic terms how what an erection is. And when it comes to treating erectile dysfunction, knowing that mechanism or understanding that mechanism, at least from a physician standpoint, is quite important to figure out what the best treatment option is for a patient. But yeah, that's the basic mechanism of how the patient erection goes from the flaccid state to the erect state. Once you finish ejaculation, that blood flow coming into the penis decreases, therefore more blood flow is able to go out through the veins, and you're able to get it back into the flaccid state. Next slide, please. Now, intracavernosal injections are obviously an awesome option. About 90% of my patients use intracavernosal injections. Prior to this, patients use the oral therapies, the Viagras, the Cialises. At some point, it doesn't work for men, and that's when we think about intracavernosal injections, which it's a great option for a lot of guys who don't want to do surgery, which is the penile implant. Again, this is the bulk of men who have erectile dysfunction use this. There's a lot of taboos associated with it, injecting your penis with a needle. But once you break that taboo, once you're able to try it out, I always tell guys, try it out. It sounds weird, it sounds difficult, it sounds painful, but very few patients turn away from this. A lot of them continue along this for a long duration of time. So the intracavernosal injections are, think of it, I tell guys, think of it as like liquid Viagra. Obviously it's not, but what it is it's various chemicals. So there's 4 different chemicals depending on where you start. So essentially these 4 different chemicals act to increase that, or basically increase the dilation or dilate that artery that we talked about that brings blood flow into the penis. By doing that, you get more blood flow in. More blood flow squeezes against those veins, giving you more blood that stays in the penis, giving you a stronger, longer lasting engorged erection. Now, the different chemicals, one of them is alprostadil or prostaglandin. This is the mainstay. This is the one that we use. In rare cases or in uncommon cases, patients get pain associated with the prostaglandin. So if that happens, we try different concoctions. Bimix, which includes papaverin. Trimix, which is 3 components, includes phentolamine, and then quad mix, which is the heavy hitter, the big Bertha within the intracavernosal injections, that has atropine in it too. So these 4 different chemicals work along different pathways that again increase blood flow, or dilate the arteries to the penis, bringing more blood flow in. So the Bimix concoction here at MedMen, So this is the beauty of intracavernosal injections. It's not one size fits all, right? So I always tell guys, be patient with it. You're gonna have the first time you inject, by no means it means it's gonna give you a super strong erection. No way. In number one, you could increase the volume. So if you start off with Bimix number 4, let's say, right, it has a particular concentration. You start off with we call it 10 units or 1 milliliter. You start off at 10 units. It gives you a 50 or 60% erection. Next time you go to 20 units, you could increase in increments of 5 or 10, no more than that. Increase of increments of 10. Let's say next time you go to 20 units, gives you 80% erection. Next time you go to 30 units, you're getting those super strong erections, 90 or 100% erections. You stay on that. Over time, it may not work as well, so you may have to increase the volume. Sometimes you have to increase the volume so much that it's no longer giving you the benefits that you were first experiencing. If that's not because so much that it has to do with the fact that the medication is not working, but it's essentially the aging of the penis, right? Like any other organ, our heart, our lungs, our kidneys, our penis is going to age in a similar way. So the Bimix that you first used 5 years ago and it was giving you a super strong erection, it may not do that 5 years, 10 years down the road. So what do you do next? You go to Trimix. You could start off with a Trimix number 5, which has 10 milligrams of prostaglandin, 30 milligrams of papaverine. And then if that doesn't work, not only can you increase the volume within that category, but you could also increase the concentration. So you could go from Trimix 5 to Trimix 15. And then let's say those don't work, you go to Quadmix. So there's so many ways in which we could personalize or custom tailor this to your needs. You'd be hard pressed to find a guy who doesn't respond to one of these. Again, as I said earlier, the main reason why guys don't use intracavernosal injections, some guys from a logistical standpoint, it's not great for them. But in rare cases, the papaverine, or excuse me, the prostaglandin could cause pain. And that's a hard one to, if you are experiencing painful erections with the prostaglandin, then again, there's different concoctions and combinations we can make. But the whole point here is be patient, right? The first dose you use, the first concentration you use will not be your last. So you can work your way up, you could play with it. Practice makes perfect. The more you try it, the better off you will be. So, and then this is a very common question guys ask, what about the needle? I'm sticking my penis with a needle. Doesn't that hurt? Isn't that weird? So think of it as an insulin needle, right? A lot of guys or a lot of men and women are injecting themselves with insulin multiple times a day, 3, sometimes 4 times a day in order to control their blood sugar levels. An insulin needle is so small, and although our penis has tons of nerves on it, which are involved in sensation, once you break the taboo of injecting your penis with a needle, with one of these insulin syringes, it becomes very, very easy. You kind of forget that you're doing it. It becomes commonplace like any other thing. So breaking the taboo, try it. I always tell guys, try it. You will do better. It will get easier and easier each time. The first time you try, it's probably the hardest time. So basically, you inject yourself with the needle. As soon as the needle is inserted, the key thing here is when you inject with the needle, you want the needle to go all the way in. You want to hub the needle all the way into the erectile bodies of the penis. So we always tell guys when you're injecting, if you think of it as a clock, you want to inject anywhere from the 8 o'clock, from the 7 o'clock, from the 8 o'clock to the 10 o'clock, right? So on one side, and anywhere from 2 o'clock to 4 o'clock. So you're really trying to aim for 3 and 9 o'clock. Those are the safe areas of the penis. The top side, you have the blood vessels and some of the nerves. You want to avoid those. The bottom side, you have the urethra, which is where you urinate out of. So you want to avoid those. So you want to aim at those. And as I said earlier, you want the whole needle to disappear inside your penis because the erectile body on the outside of it, there's some very thin layer of fat and some skin. So you want to penetrate through all of that to get it into the erectile body, which is where this is going to work. If you don't get it inside the area and you get it just underneath the skin, it's not going to work. So that's a common complaint that patients make. It's like, oh yeah, it's not working. Well, it's because they didn't go all the way in into the erectile bodies of the penis. And as I mentioned earlier, 0.3 milliliters is equal to 30 units. 0.5 is equal to 50. So we like to say units, so 10, 20, 30, and each time you could increase in increments of 10. As I mentioned earlier, so when it comes to starting dose, the first dose is never your last dose or your final dose. So always adjust. Logging your progress is a great way of monitoring your progress, giving your doctor an informed progress note in terms of how you're doing in terms of response to each dosing, each concentration, each volume. I like to tell guys, document 0 to 10 exactly. So 0 to 10, 10 being the strongest erection you've ever had, 5 being just good enough, or 6 being just good enough for penetration. And I like to tell guys, if you get into the 8 range, like 80%, you're in business. Any more than that, you run the risk of something called priapism, and that's when you have an erection lasting longer than 4 hours. Short term, that's a lot of fun. Long term, that can be quite painful. You have to go to the hospital, you have to go to your doctor's office, they have to stick more larger needles inside your penis in order to drain the blood out, or give you different substances in order to decrease or shrink, basically to kill your erection. But that being said, remember, be patient with the progress, be patient with this, log your progress. It makes it a lot easier for yourself and for your physician to track things. So how to prepare for the injection. So we'll talk about gathering the supplies, preparing the medication, and the injection itself. So really the supplies, you can have the needle, you can have the vasoactive substance, or the trimix, bimix, quadmix, whatever substance you have. Really, actually, we go to the next slide and I'll go over it. So the medication vial, the syringe, and the alcohol prep pad. So one thing that a lot of guys, one of my patients told me this, and I've copied this idea, I've told a lot of other patients, is preload your needle. So I tell guys once a month, if you know that you're going to be using 50 units of, or let's say 30 units of trimix. At the beginning of every month, patients will go in there and they'll draw up 30 units in 10, 15, maybe 20 syringes, and they'll just leave it in their refrigerator. Therefore, anytime they're ready to go, they just go grab the needle from their refrigerator and inject themselves. They don't have to, it maintains some of the spontaneity associated with intercourse. So rather than going in, drawing up a needle, pulling out, during foreplay, they're getting excited, then they have to go to the refrigerator, draw it out, inject themselves. It's much easier to go in there. Everything's preloaded. You get it from the refrigerator, you inject yourself, you get back to business. So that's one thing to consider. And then finally, you need an alcohol prep pad in order to clean the penis, making sure we minimize any chances of infection. So in order to prepare the syringe, you basically have to pull the needle off. You inject the needle into the vial, trimix, bimix, what have you. But the key thing is you have to flip it upside down. You want to make sure that the needle is in the fluid, right? Otherwise, when you're drawing out, you don't want to be drawing out air. It's too deep inside the vial. You're going to be drawing out air. You want to pull it out just enough where the tip of your needle is in the liquid the entire time while you're withdrawing. And in doing so, you're making sure it's only liquid that is going in the vial. I've had patients, whether it's with testosterone or intracavernosal injections, they're pulling out air rather than the liquid, and they inject themselves with air, which is obviously not the way to do it. So pull it out, and then lastly, when it comes to, you want to make sure that you're eliminating all the bubbles. So you could flick the needle, all the bubbles flick the syringe, all the bubbles within the syringe will climb up to the top, you get rid of the air, and you're ready to go. As I mentioned, when it comes to injecting, on one side of the penis, you want to target 2 to 4 o'clock. You really, on the other side of the penis, 8 to 10. When you're injecting, the key thing is you want to position it at a 90-degree angle, right? You want to hit it directly at a 90-degree angle into the penis, making sure that the entire, as you can see from this image here, the entire needle is buried underneath the skin or inside the penis. Therefore, you're ensuring that the tip of the needle and where the active ingredient is going directly into the erectile body, giving you maximum benefit associated with this substance. Don't inject the top, don't inject the bottom. That could cause bleeding. Sometimes the tip of the needle may go into the urethra. If that happens, obviously, it's a weird feeling to have blood in your urine. If that happens, definitely talk to your provider or your urologist, as we can help you mitigate that. Side effects. So use the proper injection techniques. The first injection is usually taught in the practice office, so that's one thing to be aware of. One thing that's very important here is rotate the injection sites. Well, for one, so we've discussed, where on the penis we should do it in terms of 3 o'clock, 9 o'clock, but also you want to inject it at the base of the penis or closer to the base rather than at the tip of the penis. Go closer to the base. If you're going to rotate sides. So one time do it on the left, one time do it on the right, back and forth, back and forth. Don't always do it on one side. Don't use it more than once every 24 hours. That's the other thing. So no more than once a day. Don't do it in the morning and again do it at night, because it takes a while for this to dissolve. Sometimes you have remnants. Sometimes you have a compounding effect. So if you inject 30 units in the morning and you inject again 30 units in the evening, that 30 units may still, the substance is still a little active inside the corpora, inside the erectile body. Therefore, you compound it with more, you run the risk of priapism, which is the erection lasting longer than 4 hours, which is obviously not a good idea. Finally, keep it refrigerated in order to make sure it's as fresh as possible. And bimix and trimix, the multi-use vials are safe up to 28 days after first puncture. So that's something to be aware of as well. So when it comes to accessory kits, injection accessory help, there's injection tools, safe syringe disposal, and a travel case. So these are things to be aware of. So obviously when it comes to, so some guys also, because obviously injections work so well for patients, sometimes older patients, some patients have a shaky hand, for example, they have a tremor. So one thing that works well for them is the inject ease, where they're able to load the needle within this, and it becomes like an auto injector. It's a trigger that auto injects the liquid inside the penis rather than the patient injecting it themselves with using their fingers. Using an insulin tote is a great way to travel with this. Obviously, you want to keep it refrigerated for as long as possible. So the substance stays refrigerated. The insulin tote keeps the needles, the alcohol, the syringes, the needles, the alcohol prep pads with it. And then finally, you want to make sure you're disposing everything in a sharps container afterwards. You don't want to dispose of this in a normal trash can because sharps, needle tips, and the such aren't made for that. If you do, obviously MenMD, we specialize in this when it comes to the various bimix, trimix, quadmix. If at any point you have any questions, whether it's ordering, purchasing, or even when it comes to questions about it, how to do it properly, there's personal health assistants that we'll talk to you about the effectiveness, the dosing, as well as how to do this properly.
The following video will show you how to set up the auto-injector as well as perform an injection with that auto-injector.
For the 31 gauge 5/16 1 cc syringe, we're going to be applying the smaller of the two spacers plus the attachment that reads 50 onto the auto-injector. All right, so this is going to be the setup for the 31 gauge 5/16.5 cc syringe. We'll be getting the auto injector with the thicker of the two spacers, applying that onto the auto injector, along with the attachment that reads 30 or 0.3. This will be the setup for the 29 gauge 1/2 inch 1 cc needle. You'll be getting the auto injector and applying the attachment that reads 100 on it. Making sure that the T-bar is pulled back, and we're going to load up the syringe. We're going to pull the cap out. You're going to put the needle mid-shaft like you would with a manual injection. You're going to press the button on the side that's going to push the needle in, and then you're going to push in the medication.
So yeah, that is a brief overview of the auto-injector device and injecting with that. Moving right along, we're gonna head into some of the Q&A here. Thank you to all of you who have submitted a question before the event. So to start us off, we have some general, or maybe one or two general ED questions here, which I think are pretty important, I guess, to cover. So what are some tactics men can use to improve or resolve ED before it becomes a problem? And is ED reversible?
Yeah, so the question was what tactics to preserve erectile function?
Yeah, I guess to help prevent it or prolong it from happening.
Yeah, so erectile dysfunction, what's good for your heart is good for your erections. So I'll keep it very simple. Really what it comes down to is just maintaining a good, healthy quality of life. So sleep well, right? Try to get at least 7 hours of sleep. The reason I say that is because that's good for your testosterone levels. We know that for good blood flow to the penis, you need healthy testosterone levels. Healthy diet, unhealthy diets, you get diabetes, high cholesterol, high blood pressure, all of these things, they calcify the arteries that carry blood flow to the penis. So that decreases the amount of blood that goes to the penis. So healthy diet is quite important. Exercise for the same reason, keeping good vascular blood flow, keeping good blood flow not just to your heart, but you're also your penis again. And then lastly, minimizing stress. The reason why stress is so important is because higher stress levels, so the same precursor hormone that goes to the stress hormone is involved in going to testosterone production. So if you're more stressed out, you have less testosterone levels. So those are the 4 ways of doing it. Obviously, there's tons of supplements. There's different things you can do to boost up your testosterone levels, those kinds of things. The science on them is good for a lot of them, but and I won't even get to that part. But those 4 things, if you could do those, you're going to maintain good, healthy erectile function. And more importantly, you're going to have good, healthy cardiac function and overall health. So that's the way to do that. And the second question was?
The second question was, they're wondering if ED was reversible. So I think it's pretty inevitable, and they're wondering if you can reverse it ever.
Yeah, it's a tough one in the sense that I think you could delay the onset of it, right? But we're all going to get erectile dysfunction. Once you get erectile dysfunction, the best thing to do is you want to revert, or you want to go back to doing those 4 things in order to delay the progression of it. Everyone, like I said, everyone's going to get it. Sometimes you could blunt the curve, so you could get into your 60s or 70s versus your 40s and 50s. But it's not necessarily, you can't reverse it. You could just decrease the decay, if you will.
Moving right along. So this is the topic of tonight's discussion. When oral ED medications do not work, what makes this injection therapy that we've discussed more effective?
So oral medications, you're taking them and they're being processed by your GI system and your liver, and it has a systemic effect. So it works, in all the blood vessels in your body, but primarily the blood vessels of the penis and the pelvic area. Whereas the injections, they're focused directly in the penis, in the erectile bodies of the penis. So you're getting a concentrated dose directly at the target organ, rather than taking a pill that's going to have a systemic, or it gets diluted in the rest of your blood flow, in the rest of your blood, as well as going to other vessels and parts of your body. So it's just a concentrated dose at the target organ is the reason why injection therapy works so much better.
Let's see, next question here. What are the latest injection therapy meds that have been proven to be effective? I think that would probably be Quadmix, if I'm not mistaken.
Yeah, exactly. So the science is advanced. We first started with one component, prostaglandin, then papaverine. Now we're at Quadmix, where we had atropine. So that's the big Bertha amongst the intracavernosal injections currently.
Let's see. Would you say that injection therapy can create a firmer erection than Cialis or Viagra? And would this erection last longer?
Yeah, definitely. If Viagra and Cialis are not working for you, injection therapy is a great option. It's a great option. It's a more reliable option as well. I mean, Cialis, it worked. There's no dietary restrictions associated with it. Viagra, there are. So if you've had drinks, if you had dinner, and you take a Viagra, it's not going to work as well because you have to take it on an empty stomach. So the oral therapies are not as reliable, whereas the injection therapy, there's no mixing it, right? I mean, there's no food, no food. You're directly injecting it into the target organ or the penis. Therefore, it's way more reliable than the oral therapies, and way stronger because of the fact that it's a concentrated dose directly into the penis.
Let's see, next question here. We see this quite a few times. Any idea why injection medications are not covered by insurance companies?
It's a great question.
I do have a MedMD answer, and what we have been told from our patient health support team is that insurance typically doesn't cover intracavernosal injection therapy treatments such as Bimix and the others we've mentioned because they are compounded medications that aren't FDA approved. So unfortunately, there's not much room there for coverage.
Yes.
Alrighty, moving right along to the next question. Do you lose any sexual sensation when erect with the injectable medications?
Absolutely not. If anything, you get stronger erections. You're going to get stronger erections. Well, excuse me, you're going to get more sensation. You get more stronger erections. So the penis stretches out even more. As the penis stretches out even more, the nerves for stimuli, for sensation get more stretched out, and therefore they're more sensitized and everything becomes more pleasurable. So the stronger your erection, the more pleasurable it will be. So therefore the injection therapy does the opposite. It makes things a lot more sensitive and a lot more pleasurable.
Can't complain about that. And a follow-up to the previous one about insurance, the note I was sharing was from MedMD's perspective. We're a compounding pharmacy, so our medications are not FDA approved, but there are intracavernosal products out there, name brands, that are covered by insurance companies. We just do not carry those at MedMD, so we cannot speak on that. But carrying on here, can penile injections also affect the length of the penis besides the hardness?
Not really. Your penis, it's not going to add any length, right? But one thing I'll tell you is the penis really is one of those things. If you don't use it, you lose it. So if you're not getting strong erections, what happens? If you're not getting regular erections, nocturnal erections, like we all did when we were much younger, what happens is it starts to scar down or shrink in size, whether it's in length or in girth. So the penile injections, what they can do is they could obviously preserve. You're getting good, strong, very strong erections. So therefore, you could maintain length and girth, which typically, as the aging of the male penis is, it shrinks in size as we age.
Next question here. Saw this a handful of times as well. How many times is it recommended to inject in a normal week?
So I say no more than every 24 to 48 hours, right? So initially when I started my practice, I would tell guys don't do it more than every other day. I've had a lot of guys who broke that rule, and they would do it every day, which is fine. So I would essentially say don't do it more than every day. So no more than once a day. And obviously 24, I would say 24 hours.
Alrighty. Are there, I guess this is a follow-up to the previous question about the insurance-covered injection meds. So someone's asking about injection pens. That's not something we offer at MedMD, but perhaps you could fill us in on those.
Yeah, or like they're thinking like Ozempic or something like that. No, unfortunately not. There's no auto-injector, like one size fits all, because everything is so custom tailored to the individual. You have to, if you're looking for something like that, you have to you have to load up your own syringe into the auto injector.
This person here says they've tried Trimix but cannot tolerate some of the penile aches they experienced. To their understanding, there may be other formulas that may not give them this adverse reaction to key ingredients.
Yeah, so that's a great question. So prostaglandin is usually the culprit when it comes to penile pain. So the way you could play around with that is, if you look at MedMD website, for example, Trimix, there's different concoctions of Trimix, different combinations. So if you're getting the prostaglandin at 20, you could decrease that to 10 and increase the papaverin. You can increase the phentolamine, whatever it is, but you have to decrease the prostaglandin in order to decrease the pain associated with the trimix injection. So you have to play around with that combination in order to prevent that penile pain.
Alrighty. Saw this question a handful of times. There's some people out there that find their normal injection amount works perfectly, and then other times not at all. And they're just having some troubles understanding some basic factors that could be playing into that.
Interesting. I've heard that complaint as well. When I hear that, I think to myself that the injection technique isn't always consistent. It's not always done the same way, because as long as you're getting the substance into the erectile bodies, it should work the same. Now, are you going to have some variation where you're going to have like a 9 out of 10 erection one day, 7 out of 10 erection the next? Sure. But you're not going to have a 9 out of 10 erection one day and like a 2 out of 10 the next day, unless you're injecting it into the wrong spot. So I would focus on the injection technique, or at least review the injection technique just to make sure you're consistently doing that each time.
Alrighty, moving along to some dosage questions here. Pretty good question. This person wants to know how to find their effective dosage without risking taking a overly large initial injection. I think that's normally done in the office, but the second part of this, which is probably a great question as well, without spending incremental increased costs. So
it's a good question. So it comes down to the way I like to do it is, and every urologist is a little different, but what I would tell you is it depends on how bad or how severe your erectile dysfunction is. So, for example, if you're taking the oral therapies and you're maxed out on the Viagra's and the Cialis, and your erections are 1 out of 10, 2 out of 10 at best, you're going to need, like, prostaglandin by itself, probably won't do the trick. Bimix by itself probably won't do the trick. Like, you're going to need like a lower dose of a trimix, for example. But if you're a guy who's, you have good response to Viagra, you have a solid response to Cialis, and your erections are 4 out of 10, 5 out of 10, doesn't get any better than that, maybe you could respond to the prostaglandin. So not everyone's going to start off at prostaglandin and then go to Bimix and then trimix. You kind of have to gauge the patient depending on how severe their erectile function is. Some guys could skip a few steps. So it's a stylistic thing amongst your provider, your urologist. But I agree with you. You don't want to be wasting too much money doing that. And it's important to express that to whoever's prescribing that to you.
Great points. So I think we kind of talked about this, how over time the same dosage will diminish in effectiveness. So how to increase the dosing if you're finding over time your standard dose is not as effective.
Sorry. So yeah, like I said, I tell guys to increase in increments of 5 or 10 units. If you've been on 40 units and you feel like your erection's at 6 out of 10, it's not what it used to be, and you increase by 10 units and you're like, oh, it's too painful, the erection is way too painful, go down by 5 units. So there's a style. Obviously, there's a style to it too, and as patients, you don't necessarily need your doctor's orders each time to do that, but just remember, you could increase in increments of 5 or 10 units safely. Increasing more than that, you run the risk of priapism. So you could go up by 10, go down by 5, play around with it if you'd like, and you could do that very, very safely.
Alrighty. Another question here, saw a few times. This one probably isn't in the dosage category, more so the general, but is there any age limit to this therapy? We have someone here who is 78, says they're in great physical condition, and they're wondering how much is too much in terms of increasing their dose.
Yeah, so I say don't go more than 100 units, right? So some of these syringes are only 50 or half milliliter. Some of them are 1 milliliter, so 100 units. So, but you don't want to be drawing out 100 units and injecting, and then drawing out more and injecting. At that point, you have to start thinking about either going to quad mix, upping the concentration, upping the ingredients. You want to think about the next step at that point, but no more than 100 units each time is my rule in order to before you. If you go above 100 units, then you have to talk about different chemicals and different treatments.
Alrighty. Moving along to some injection technique questions. Saw this a handful of times here. So if you inject repeatedly in the same location, will you or can you develop scarring?
Yeah, so definitely, and that's something to be aware of. The more you inject, so every time you inject into the corpora, it's a very delicate tissue. Your body responds to that. It takes a little bit of an insult. So over time, you're doing this for 10, 15 years, you could obviously create scarring in that elastic, smooth muscle. It's supposed to be very elastic. So what that can do is it loses that elasticity. Therefore, you get weaker erections as a result of it. So intracavernosal injections, as they work fantastic. But listen, there's no such thing as a free lunch, so everything has a side effect, and that's the main side effect associated with intracavernosal injections.
Alrighty, I like that one. No such thing as a free lunch. So, next question here: if the injection does not result in what you want, is it possible to re-inject on the other side right after?
No, please don't do that. Please don't do that. Yeah, not right after. The next time you can do it within, after 24 hours, but not immediately.
Alrighty, do not do that. Next question here: with repeated injections for erection, does it help or hinder me from ever achieving a natural erection after prostate removal?
Yeah, it could. Obviously, it depends on the technique, depends on who's doing it, depends on what your erections are before. There's a number of variables that go into that, but we do know a prostatectomy, there's about a 20 to 25% rate of impotence. That could improve after surgery, depending on your regimen, depending on how the surgical technique was done, all those things. But that is a known side effect of a prostatectomy is impotence, postoperative impotence. And there's ways, we can mitigate that. One of them being Viagra, the oral therapies, the other one being intracavernosal injections. But the one thing I would tell you is the earlier you get your erections going postoperatively, we have a lot of science on this. It's incredibly important. So if you're struggling with erections 3, 4, 6 months after surgery, that's a problem. You have to get going because if you don't use it, you lose it. Your penis shrinks in size, length, all of that.
So moving right along to a follow-up question. This person says that their penis is now shorter after a prostatectomy. They're finding it difficult to find an injection site, and they're looking for any suggestions to do so.
It should be the same. I mean, really, you want to look, again, like we talked about earlier, aim for 3 and 9. You could even go like 2 to 4. You could go 8 to 10. You want to aim, but the closer to the base of the penis. If you can't get close to the base of the penis, you can go a little further out. But anywhere on the penis, the prostatectomy shouldn't impact that significantly.
Next question here: is it possible to bend the injection needles during the injection process? And if so, why would this happen if being careful?
It's nearly impossible if you're using a fresh needle, because the needle is so thin and narrow. If you have a dull needle that I'm complicating this. I apologize. The answer is no. It's nearly impossible to do that.
Certainly. Yeah, if that happens, you might need to revisit the injection technique.
Precise. Thank you. Exactly right. You need to revisit the injection technique. Precisely.
So we talked a little bit about auto-injectors helping people with dexterity issues or just getting over the fear of the needle itself. But this person's asking, does using an auto-injector reduce the chance of scarring and possibly Peyronie's?
No, it doesn't. The auto-injector doesn't decrease that risk. You're still penetrating into the same tissue with the same needle tip, so it doesn't change it.
Right. Next question here, very great question we see every event, or every time we run this event rather. This person says it's very difficult to inject themselves because they're a rather large person. Looking for a technique that is safe and works to inject when they can't see the injection site.
Great question. Yeah, this is a common complaint, or common question, I should say. It's one thing I'd say is obviously practice makes perfect. So I have a lot of guys who they'll use a mirror. They'll look inside a mirror. They'll figure out. They'll see themselves, but in order to do that, so that's one technique. And to my point, practice makes perfect. The more you do it, the easier it gets when you're looking at the mirror. Or they have a partner who does it for them, whether it's their wife, whoever it is. But they have a partner inject because they can't see it. So it is more common than you think. What you're describing is way more common than we think. So, but there's ways to mitigate that. And those are the two I generally suggest. Look at a mirror and then have your partner do it. All right. I don't know if you could give any, since you've heard the question.
That's what we've heard in the past too, and what we also recommend is partner laying down on the bed, looking in a mirror, or sitting down on something and looking into a mirror, just somewhere where you can see yourself, I guess, and also be seated and safe. So yeah, next questions, our next set of questions we're moving along here will be about using injection therapy with other therapies and or conditions. So quite a handful of different ones here. The first one is, can injection therapy be used with a VED?
It can use it at the same time concurrently with a VED. You shouldn't need to. I apologize. You shouldn't need to. So the answer is don't use it together. The strategy would be to increase the volume or the concentration of the injections in order to get a much stronger erection, rather than using the two of them in conjunction to get a stronger erection. So don't use them together. Just focus on optimizing the use of your intracavernosal injections.
Alrighty, great advice. Next question here: can injection therapy be used on blood thinners?
Yes. Yeah, not a problem. Just if you notice a little bit of blood or a little bit of bleeding coming out of the injection site, just put pressure on it. 30 seconds, 60 seconds, you can be fine. No problem.
Alrighty, cleared for blood thinners. What about using injection therapy with PDE5 inhibitors such as Viagra or Cialis or others?
Yeah, so this is a common question too. So I say it's not a problem at all, because the injections are getting into the injection therapy. It's really getting your erectile bodies. The head of the penis, or the glands of the penis, has a separate blood supply. So some guys, they complain. They're like, hey, listen, I'm just not getting enough blood flow to the head. So I tell them, just take daily Cialis, low dose daily Cialis, even if it's 5-10 milligrams a day. It's good for their prostate. A lot of those guys are already on it because of for their prostate issue, for their enlarged prostate, so it helps them urinate. So it's okay, it's safe to do that, not a problem.
Alrighty. We have a next set of questions about injection storage. I think I can read off this fact sheet I have here to answer all of them. Most of these are about the shelf life, freezing, punctured versus not punctured, or if it's safe. The general rule of thumb from MenMD, and what we tell all of our patients, is after 28 days, we cannot guarantee the effectiveness of the medication any longer. However, that being said, it's not unsafe to use it. It just may not be effective, and we cannot guarantee what we had sold you working. And this differs for different products. So Bimix, the beyond use date is 60 days. Trimix is 30. This is because of the added ingredient alprostadil. Same goes for Quadmix. And the 28-day rule that I just was mentioning was for a punctured vial. So after the first puncture, 28 days after being stored properly, we can guarantee that it will work the way we marketed and sold it to you too. But after that, the medication, as it's compounded, starts to lose some of its effectiveness and will not be as effective. So I think that should cover all of the injection questions there. It's basically a do-at-your-own risk type of thing, but you're not going to be at any adverse risk, I would say. So next group of questions here to wrap up the event will be about injection side effects. So can you use Sudafed to help with an erection that's lasting longer than 4 hours?
Absolutely, absolutely. So Sudafed is a great option for that. So the earlier you take it, the better. The other thing you could do is urinate. That emptying the bladder helps with getting blood flow back to the body, and then ejaculate. That helps as well. So those are generally the three techniques I tell guys if before, God forbid, having to go to the hospital or go to their doctor's office. Do those 4 things. Put ice. The other thing is put ice on the suprapubic area, right at the top of the penis. Put it around the penis. Put it in the perineal area, the area between between the scrotum and the anus. That helps as well.
Next couple questions here are a bit similar, but we saw them a few times and they're a little bit different. So first one is it normal to experience swelling and redness at the injection site? And if so, what can be done to prevent this?
You shouldn't have too much swelling. I mean, it can happen once or twice. Yeah, that's fine, but that shouldn't be a common occurrence. Usually, again, that means the injection technique is you're not doing it the right way. You're injecting the needle into the skin layer. Sometimes the other thing to note is the penis itself has a number of superficial veins along the like underneath the skin, but not in the erectile bodies. Avoid those. That's another reason why you get bruising and swelling. Sometimes, whether we see it or not, we inject it directly into that vein, and that bruising happens. Again, if it happens once or twice, it's nothing to worry about. But if that's happening more times than not, then your injection technique needs to be revised.
This person asks, does injection therapy work independent of sexual arousal?
Excuse me, it does, but not the way it would with sexual arousal. So you need that sexual arousal in order to get things going. Can it give you somewhat of an erection? Can it take you from 2 out of 10 to 4 or 5 out of 10? Sure, but it won't take you the rest of the way. No.
Alrighty. This person here says, what if you go through a vein while injecting and you see blood underneath the skin? Will this vein/blood heal on its own?
Yeah, they just put pressure on it. Like I said, 30 to 60 seconds, put pressure on it. You'll be good to go. Nothing to worry about.
Would a narrower gauge needle reduce scarring and possible chances of developing Peyronie's?
Probably. That's a good question. Yeah, it's a good question. Probably not to a significant, not significantly, because I mean the diameter of these needles it's microscopic differences. So I would say maybe, but probably not.
We'd like to thank you all for joining tonight, and we'd like to thank Dr. Houman for presenting. If you'd like to learn more about injection therapy, all of these guides for any of our products or treatments are available on the MenMD website, on the resources page. If you'd like to contact MenMD support, this will be how you can have your question answered if it wasn't answered during this event, unfortunately. You can call MenMD at 857-233-5837 or log into the MenMD portal to schedule an appointment with a MenMD personal health assistant. If you're interested in injection accessories or learning more about any of the injection products that we talked about today on tonight's call, you may do so on menmd.com and navigating to the erectile dysfunction condition. Under there, you will see all of the products, so the various formulations of ICI medications where you can actually compare. And if you're interested in any of the injection accessories, so anything from syringes, alcohol swabs, the Insel tote, you can find this on the MenMD shop page. Thank you everyone for attending tonight's webinar, and we hope to see you at the next one.
If you found this video helpful and want to stay in the loop with our growing men's health community, be sure to subscribe to our channel and click the bell to be notified when new content is available. Your support makes it easier for other men like you to find these helpful resources. Thanks again for watching. We hope to see you again.